I'm a retired teacher, and I have sailed all my life whenever COVID was, I bought a big sailboat. I really didn't have back problems. I had pain in my legs, and it's probably started when I was in my 40s, and it would be if I was in a position for a long period of time. It was the kind of thing I could ignore because it went away, and then when it came back, it seemed to be out of the blue. But about 10 years ago, it came more and more often that my legs would be in huge pain, it would be out of the blue, like a knife cutting them or fire in my legs to the point where sometimes I couldn't walk. And I had no idea what it could be. And finally, I mentioned to my GP what it was. It ended up at a pain doctor who actually sent me to a surgeon who told me that I had such bad back problems that I was beyond him. And he said I should go see Dr. Mayer. So I got in to see Dr. Mayer, and I learned that I had my spinal cord had a lot of scar tissue, and was also a little bit of arthritis, and it was taking all the nerves that go down into your legs, like your sciatic nerve, but it turns out there's more than that. And when that got inflamed, it was pain in my legs. Dr. Mayer eventually told me, he said, this will get worse, you can't fix it, and at some point you won't walk. And then on top of it, it turned out I also had scoliosis. I couldn't even walk to my boat, much less sail it. I could go on an airplane, but then I'd be in pain for days afterwards. I cried the first time I knew that there was something, that they knew what was going on. I thought, well, this is just going to be one of those things where they go, oh, that's interesting. Tell me if it gets worse. The other really kind of interesting thing was that he was like, we're going to really take some time and figure out what it is that's going on with you. He didn't say, oh, let's get you into surgery right away. He was, let's find out what's happening. Let's observe this over time now that you know what you're looking at. He explained, every time I came in, he explained what it was I was feeling. And I have to say that during this time, I think that more than Dr. Mayer was his team of people. They were outstanding and spent time with me. I felt like they knew what was going on, and they made sure I knew what was going on. All of them, from his physician's assistants, his secretary, to the nurses, everybody was making sure that I knew what was going on. If I needed to come in for an unscheduled appointment, they were there. He told me, this is a big commitment. And when you do this, you're going to have to be really ready to work at getting better. So about 4 months later, about a year after I started going to see him, we scheduled the back surgery. And it was a big deal. They went through my stomach one day, and then 2 days later, they went back through my back, and they were making room in my vertebra so that the nerves would not be squeezed anymore. And the second time they put a rod in my back about halfway up to correct the scoliosis. I'm able to climb up on my boat. I'm able to climb up, take my sails down. It's a 30-foot boat. And I can get up and take my own sails down. I can put them up. I can sail that thing. They put me with a physical therapist that is an amazing woman. I think it really speaks to communicating with people about what it is you're after, because she would say, well, show me what you do when you sail your boat. And there's a lot of oblique muscles and things like that you have to learn to turn when you have a rod in your back. And that's a new skill, but it can be done. And it's just a lot of things I had been doing were adjustments because my body wasn't doing the right thing anyway. So that was all learned behavior. I believe it's a really beautiful thing to work with people who are passionate about what they do, and that's Dr. Mayer. He's passionate about what he does, and he understands that it's not only a team with his medical team, but teaming up with me as a patient, because I have to be as committed as he is, and he makes me want to be committed when it's difficult, and it can be very difficult. I kind of sometimes feel like I don't want to let him down, but he doesn't ever make you say anything like that. It's just that he is a very inspiring person who obviously cares about people and what he can do to help. I feel really lucky that I was referred to him and was able to be his patient. And I feel like I'll always be his patient.